welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Joining me in studio today is Ms. Dinty Conway, the Director of the Food Policy Unit, Dr. Shaliza Gopi, Technical Officer for Tobacco and Alcohol Control, and Dr. Davina Ram Singh, Technical Officer for Diabetes. Welcome, everyone.
Thanks.
Thank you.
So I know on March 4th, we will be observing World Obesity Day. But before we get into the details of this program, which we'll be talking about obesity and good healthcare practices, Miss Conway, could you tell us about the overview? Give us an overview of the obesity situation in Guyana.
So thanks again, Alicia, for having me here. We have a problem in Guyana, and I'm really glad that at the beginning of the year we're dealing with this topic because the prevalence of obesity in Guyana is very high. It's for females 27% and for males 12%. And in any unhealthy situation, what we've noticed too, females are surpassing the men. Um, Obesity is being measured in Guyana's context from your BMI. So if you have a BMI over 30, you're considered obese, right? And the acceptable range of BMI is 24.9 up to 24.9. So we have people who are 30 plus in Guyana. And even though it says the overall obesity for both sexes are 20.2, we have high rates of overweight.
Wow.
So overweight is just before obesity. So you gain weight so fast, you can become obese, within days, within weeks,
Yes.
right? So it's a big problem. I know in the Caribbean, we have a lot of, the culture is for people to look a little fluffy, a little thick and stuff. But it means being fluffy and thick means you have more weight than you're supposed to, right? For your height, for your age, and for your activity level. So it's a really big concern for us in Guyana because it leads, obviously, one of the main contributing factor to NCDs that my
Yes.
colleagues will speak about. And that NCD rate is also very high in Guyana. I think 60-something% of the deaths are attributed to one of the NCDs. So we have a huge problem that we're trying to tackle from the Ministry of Health perspective.
And I know the ministry would have been talking a lot about prevention. Dr. Ram Singh, could you briefly explain the importance of healthy eating to prevent obesity?
All right. Greetings, everyone. And thank you again, Alicia, for having us here. And as my colleague said, it's a good forum to start on at the beginning of the year. This is where we want to capture everything. Now, she did mention something called BMI, and I'm sure that many persons will wonder what is BMI. So it's your body mass index, right? And it's not just jumping on a scale and taking your weight and say, oh, I am 140 pounds or 200 pounds I need to throw off. It depends on your height. For a person short like me, I can't have 200 weight. Somebody taller, 200 weight might be equal for that person's height. So BMI is there to measure your height, your weight. And it has to do with the relationship with your weight and your height, right? So oftentimes you go to the healthcare, wherever you go, to your doctor, to the health centers, they would take your height, take your weight, and there's a reason why, right? So that we as medical professionals know how much you have gained within a period of time and what is there that we can advise you to do. So now you're talking about healthy eating, and we go away from the term diet because it's a scary topic for many persons. It means starvation for a lot of persons, right? Or doctors stopping you from eating things that you probably like. So we're here to tell you that you eat whatever you have in your kitchen, whatever you can afford, right? Because I don't know what you can afford, and it does not make a reason for me to tell you you have to eat this amount of this and this. We're asking you to have limitations, have portion sizing,
Yes.
right? And as you can see from our chart here, it's showing you all the food groups that you can have, right? It's going to be a lot. Not everybody's adapting to the same food or not liking the same food, but it's there to help us what we can choose to eat. All right. And I'm going to refer to our farmers market that I saw started in last Sunday at Luzignan. And those are little things that we're trying to work on to help out in this type of illness that we're suffering from that would cause other complications, right? That we're going to mention on later on in the program. So portion eating, watch what you eat. It's all about having limitation to what you're eating. We're asking that persons eat at least 6 times a day. It does not mean 6 heavy meals. It just means you have 3 heavy meals, which is your breakfast, lunch, and your dinner. And in between, you snack in between, where it's going to be like your 10 o'clock snack and your 2 o'clock snack. It could be a fruit, a glass of milk, some amount of juice, but just avoid having too much of one thing. You know, in Guyana, we believe that eating one food would always help you. So people hear that oats is good for you, they eat it morning, afternoon, night as that's just their meal, right? Some persons believe in provision to be their only way of not gaining weight, cutting down on the rice and the flour. It doesn't mean that. You're just not consuming one meal all the time throughout the day and every day. All right, we're just asking you to have portion in the different food groups that we have shown in the poster here.
Thank you, Dr. Ramsinger. We're going to go into a short break and be right back with more on health matters.
There are 9 food-based dietary guidelines in Guyana for you to follow and live a healthy life. Guidelines 5 and 6 deals with sugar and salt consumption. An important step we can take to watch our sugar and salt consumption is to read food labels. This is very important as there are a lot of sugars and salt in many of the foods we eat and drink. So when we are reading the labels, we need to look, for instance, at the sugar content and the amount stated, and multiply that by the servings per container to know the total sugar in the product. Or we look at the salt or sodium content and the amount stated and multiply that by the servings per container to know the total salt in the product. The daily recommended amount of added sugar for males and females should be 6 teaspoons or less, and the daily recommended amount of salt should be less than 1 teaspoon. For instance, the amount of sugar in this size of soft drink could be as much as 16 teaspoons, and in this kind of drink as much as 10 teaspoons. Please, let's pay attention to what we are eating, as overconsumption of unhealthy foods leads to many illnesses, including high blood pressure, obesity, and heart disease. Come on, Guyana, let's use the food-based dietary guidelines to reach for a better life with good health.
Thank you for staying tuned. For those persons who have just joined the program Health Matters, today we're talking about obesity and good health practices. Ms. Conway, can you tell us a little bit about the Ministry of Health implementations with regards to obesity?
So I know Doc touched on it a bit. We do a lot of counseling at health centers. So and this is targeting people who come to health centers. So a patient comes, they want to see the nutritionist. You counsel them, talk to them about healthy options. Generally, we try, from the Ministry of Health's perspective, our advice is to general public in terms of the healthy population. But if you're obese, then you really have to be a little more strict with what you're eating. You don't get away with a lot of things that a normal healthy active person might be able to get away with, right? So we do a lot of counseling. Watch what you're eating. Doc said portion size is extremely important because in one of the studies we did in Guyana, a lot of people are overeating on the bad kind of stuff. So they're eating a lot more carbohydrates, a lot of fatty foods,
sugary
stuff. A lot of sugary beverages is being sold, and you can see the profits that these companies are making. It means that people are consuming it, and all these unhealthy things are leading to these diseases. So we do a lot of counseling at health centers. We do a lot of practical demonstration, to show people that you don't need to add that much sugar in your juice. You can blend fruits. So you can blend certain types of fruits, so you won't even have to add sugar. And we give it for them to taste. So, they go away getting something, tangible that they could practice at home.
Yes, because some fruits are naturally sweet.
Exactly. Like what you mix watermelon with guava with pine, and you buy fruits that are in season. We're not, telling you to go. You buy the things that are in season, that are reasonably priced, and things like that. We go to workplaces. Well, pre-COVID, we did a lot of interventions at workplaces and schools. We know COVID came and did a lot of disruptions where, we don't want to have a lot of ganging up and so. But slowly we're starting back to do that. We do a lot of media appearances. We do call-in programs so people can call, ask questions. We accept walk-ins at our office. If you need any kind of advice on nutrition, you can call us, you can comment to us. And these are some of the interventions we have also. So eating right, eating healthy starts from way back when you're pregnant or when, as you give birth to your baby. So the Ministry of Health promotes exclusive breastfeeding, and that's one of the good methods that we try to promote to people in terms of good nutrition. So we do a lot of promotion of exclusive breastfeeding, good infant feeding. So you grow up with this trend of eating the right things. Not that you wouldn't eat fast food, you wouldn't eat certain things, but it's in limitation. And you really, really have to know if it's worth it to your body to be overdoing on the bad things more than the good things.
Yes, definitely. What is the response like from people when you guys go into the fields and so forth?
So really good. It's just that we need a lot more capacity, human resources to go, all over Guyana, because Guyana is vast.
Yes.
We have all the regions and so. But when we do go, we get really good responses. People, a lot of things people are not aware of. So we can't be judging Guyanese and say, you like to eat this or. Sometimes they don't have the info. When they do get the info, a lot of people are willing to change,
Yes. Dr. Gopi and Dr. Ramsingh, could we touch a little bit on childhood obesity? I know this is very, very important. Usually when we send our children to school, we pack their lunch bags and we give them snacks and we give them all these things. Could you tell us a little bit about childhood obesity, what causes it and some of the symptoms of it?
So childhood obesity is not generally having any symptoms, but is what we practice.
Yes.
Genetically, persons can develop starting to grow a little bit of chubby that we see, right? But generally in practice, I've noticed that if the baby don't look chubby, he not healthy, right? If the more chubby the child looks, it's better for the family. And that is something that we want to get rid of. It's not how you look. It's what you're consuming to that child, right? And I'm glad that my colleague mentioned that we're advocating for breastfeeding, right? We find that persons do not adhere to this because one, the family say, oh, the baby crying too much, we need to give them something else. They're not filled. And sometimes we start too early giving food to children when they don't need to. And the whole mechanism of digestion does not adapt for that person well, right? And just thinking of a person who has a genetic makeup of big size family, they would end up growing more than they should.
Yes.
And at the clinic, what I know they do, they have a charting where you check to see how many percentile for that child they will fall in that month. I can't give it offhand, but there is a charting that we plot to know if the child is overweight, underweight, or having normal, right? And we plot that graph according to how they come to visit, so you know how the child is progressing. Now, I'm glad also that she mentioned that they've started work in the school. And like you have mentioned just now, that we're having a lot of packet stuff, easy for parents, easy for me, right? And I'm going to tell you, it's hard to implement healthy eating when you start putting the packet stuff in the bag, because obviously we all like nice things and kids are attractive to nice things. So we as parents, we have to be a little bit more stronger. We can't make the 2-year-old be the boss of us. We have to be the boss of them, right? And we have to practice it. What we practice is what they would practice. And if you're allowing them to override you on those things, then we would not have that progress. And obesity can start very, very young. and not knowing it, because like I said, it's a culture. The chubbier you look, it's better for you, right? So we have to come out of our culture sometimes and start doing the right things and start choosing the right things for our children, because you don't want them to lead them being at 13 or even younger suffering from kidney failure or something
Yes.
of that sort. And there are many of those children who are, you would see them on Facebook asking for help. And I guess maybe it was a family inheritance to that, but also we add to it too. All right. So I'm
By the things we
advocating
eat.
that parents, healthcare workers, everybody come on board, teachers, everyone, to apply that children take healthy snacks to school. I know they have started because I have my own kids there, and I know that the teachers would always advocate that you have a healthy snack in their backpack. No aerated or soda drink or juices if they're allowed. Maybe one time a week they have a cheat day, whatever they call it. So I'm asking for schools to start implementing it for the children. Look at the cafeteria. Those little tiny things are what going to
Yes.
change a big life in us.
And we could have like fruits as a good snacking example.
And I know they do PE and stuff. I know because of COVID there's a lot of restriction, but we could advocate for tiny things, hands up, hands down. We used to do that
Yeah.
at school, stand up in and out in your chairs,
The physical education.
Right, those are little things that you can do at school, just you're not going outside, but you're right in the classroom, whoever is turning out to school,
Yeah.
you know. And even the internet classes too, have a tiny break, a 5 minutes break, let them stretch, do something that would make them active. So I don't know if Dr. Gopi and my colleague had anything else to add to that.
Right. So I just wanted to touch on some of the NCDs that obesity is a risk factor for. So we have things like your coronary heart disease, diabetes, hypertension, gallbladder disease, And we always think of obesity as a risk factor, but obesity in itself is also a disease. And if we start looking at it like a disease, then we will be more able to treat it. And, obesity in itself is, because it's a disease, it has many factors associated with it. It's not just due to a lack of willpower. You have biologic effects, you have social effects, access, and I think access is a big one. Like my colleagues were speaking about, it's so easy to go out and find an energy dense foods everywhere around the corner. You can easily find fast food, but to find healthier alternatives, this is something we need to work on,
Yes.
because that is what is difficult. If you're given the choice to buy lunch, you think, oh well, I can maybe get a piece of chicken, some fries, a biscuit, and a soda for $1,200. But if I need to go find a salad, you have to think about, where can I find a salad? How much is it going to be? And obviously it's going to be more than that one piece meal.
Yeah.
So that is something we need to work on: healthier alternatives, access to it.
Definitely. And if we're gonna try something like a salad, these are things that we can probably make at home, right, Miss Conway?
Yeah, so she's correct. When you go anywhere in the supermarkets, and so the shelves are packed with
Yes.
ultra processed foods, and I mean, we as individuals have to be conscious of it. A lot of the times, like, you think it's a harmless soft drink, but it's really full of sugar, and soft drink particularly has no benefit to you. None. It's pure sugar.
Yeah.
Right? So if you could imagine just drinking, do you just sit and eat, tablespoons and tablespoons of sugar? So you have to be really conscious and think that, is this really worth it? Just drink a glass of water, just drink some tea. You don't have to add sugar to it. So it's a healthy options. And when we do it ourselves, we know what we're putting in our foods at home. We know how much salt we're adding. And also we save money. If you buy things in the market, and so if you really sit and work it out, you save money. Right?
Yeah.
So it's good for the family pocket.
Definitely. Let's talk about the food-based dietary guidelines for Guyana. Tell us about these steps.
So these are 9 guidelines that we did consultations for, and we use it as an umbrella, as a tool to, give our advice. And it from breastfeeding, exclusive breastfeeding for the first 6 months. And that means nothing else to the baby. No, as Doc was saying, nothing, not even water the baby needs, because the breast milk has every single thing.
All
And
the
a lot of
nutrients and so
other,
forth.
exactly, a lot of the mother-in-laws and mothers like to say it's a hot country and they need something else and a bit. Breast milk only. And eat different types of food from all the food groups daily. Eat more green. And we know these things, right? We know that we should be mixing our foods. Don't just eat meat and rice. Try to add your vegetables.
Yes.
And when vegetables are... And we're conscious that you probably can't do this every single day, because sometimes, like when they have the flooding, vegetables short and right. But when you could, you stock up on it.
Yes, and this is actually good for us
Exactly.
to maintain a balanced diet.
Exactly. Less sugary foods and sweetened drinks. So I find in Guyana, this is really, really, really a bad one. A lot of the things are packed with sugar. A lot of the drinks are energy drinks, all this,
Sugar.
everything. And you know what? These companies that sell these things is profit making. When you really think about it, they don't care about your health. They want to make money, right? So when they do all these ads on the TV that certain drinks is the best thing with the ice flowing and all of that, it attracts you. You might know better, but these things are so attractive that your willpower might go. So you need to be conscious of your environment and your surroundings and so on, to make try to make the right
Yeah.
choices. Use more natural seasoning and less salt and salty products. So more ginger, more pepper, more shallots in your food rather than the aji, the cubes, and the processed things to give your food flavor. Use the natural seasonings. Reduce your intake of oily and fatty foods. If you drink alcohol, if you do, we really don't want you to, but we know that Guyanese do so in moderation, because not only the health benefit, but in terms of accidents and so on the roads that are very high. And use at least 30 minutes daily for physical activity. So it's not just saying I'm a housewife and I sweep out and you have to have your heart rate has to be a certain level higher than your normal resting rate for it to make a difference for your organs. So it's a little intense physical activity for at least 30 minutes daily, not every other day
Yes.
if you can, right? This is extremely important for your body.
And this also means some basic things that you could do with regards to physical activity.
Yes.
It might not be, for some, it might not be going to the gym, but it might be just doing a few things around the house that will keep you active.
And you can buy a skipping rope and skip right in your living room, right in your front yard, right in your backyard. You can skip, you can jog around your yard. You don't have to pay expensive, to go to gym or anything.
Definitely. So we'll go into a short break and be right back with more on obesity and good health practices.
We live in a world where undernutrition and obesity can exist side by side in the same country, home, or even person. Foods high in sugars, salt, and/or unhealthy fats are leading to unhealthy diets and are one reason why children may not be growing healthily, while causing other people to develop overweight or obesity. The consumption of unhealthy diets is heavily influenced by marketing. Easy access is fueling this new nutrition reality, but thankfully, change towards a healthier future is possible. By having a sustainable healthy diet made up of a variety of foods that are safe for consumption, we can promote health and have better abilities to fight illness. How do we do this? Good nutrition for women during pregnancy and for children in their first 1,000 days of life, including breastfeeding, sets them up for healthy adulthood and future generations. We should eat more fresh fruits and vegetables, whole grains, pulses, nuts and seeds, and less sugary drinks and foods high in sugars, salt and unhealthy fats. The less of these foods we buy, the more the food industry will be encouraged to produce foods that contribute to healthy diets. We can also call on our leaders to make the right decisions so that every person, everywhere, can afford and access good nutrition. When people like you and me, industries and governments work together to make positive changes, we can create a healthier world.
Welcome back to the Health Matters program. Before we wrap up today's program, we want to talk a little bit about the theme for World Obesity Day. Dr. Gopi, could you tell us about that?
Sure. So the theme is everybody needs to act. And so we really all have a part to play in this. There are about 800 million persons living with obesity today. And so the first step would be for persons living with obesity to speak out against any stigma attached to obesity. Many times you have this fear of going outside because as soon as somebody sees you that hasn't seen you for a long time, the first thing they comment on is your weight. That is just normal Guyanese culture. And while one person may be able to just put that at the back of their mind, other persons would stress on it. And it can really affect your mental health. And also, as healthcare professionals, we need to have empathy for our patients and start the conversation about obesity, but in a sensitive manner. And everyone else can have a part to play by, being helpful, being supportive, and not having that stigma attached to obesity.
Thank you, Dr. Gopi. Dr. Ramsingh, could you tell us about the BMI? What should persons look for when they're doing this?
All right. We didn't get to mention the score level for the BMI, Alicia, so I'm just gonna give a recap of it. If you're underweight, it's less than 18.5. For normal person, it's from 18.5 to 24.9. If you're overweight, it's anything above 25. For obesity, it's anything above 30. All right. And we have mentioned our statistics. Women are more gaining weight more than men faster. We've also found out that women are least the persons to do activity than men. So I'm encouraging that physical activity, as we mentioned, 30 minutes a day, and don't let us know that you're a housewife and you do all the work. You have to take 10 minutes out of your time. If you can't do 30, take 10, 15 minutes out of your time just to do some small exercises. Exercises doesn't mean you gotta go gym or go outside. Use the chair, do up and down motions in the chair like you're squatting, moving your legs, you're lying down in the bed, do bicycle motions. Lifting weight, take 2 bottles in your hands with water or sand and you just lift it at home. Nothing to make you feel that you have to step out there like doctor was talking about stigma about your weight. You don't want people to tell you about your weight. Start little things at home so that it's cheaper for you and it's convenient for you as well. All right. We also touched on dieting. So I'm just reminding you, we're not asking you to go and have to have a specific type of food to eat. Eat what you have at home, but eat them in small portion. Try to incorporate all the things that are shown on that table there. Use your fruits, your vegetable, whatever you can afford. Just try to use them in portion. Avoid the sodas and all the beverages that are out there. Incorporate water instead. All right. It's like you don't always feel thirsty, but you have to tell yourself I have to drink water instead of drinking a Coca-Cola. Then I can take some water. It's important to have those things. Those things help you to maintain your weight. You might not lose the weight. This is not something we click our fingers and it happens overnight. It takes a process. It takes years of accomplishing things. And if we don't start to be determined, we can't get that there. And I just want to leave this. Self-determination is a disease. If you don't have that, you can't go anywhere further. All of us can sit here, have many programs, have a lot of things going on in the healthcare facilities, but we as a person have to have self-determination because that deals with your physical ability, it deals with mental status of you, and we have to push ourselves to make a change, right? And it only happens when you start that 5 minute, that 2 minute that you take to adjust on something. If it's a meal, if it's your exercise, it's something that you've done and you mark it down. You know what? Today I've done this, and mark it in your calendar so you know that I've made a progress today. Tomorrow I'm going to do something new. So just want to leave that with you. Self-determination is the biggest disease you can deal with. All right?
Thank you, Dr. Ramsingh. Ms. Conway, do you have any words of encouragement before we go to those persons who are watching and listening to us?
Yes. So I really like what she says, because it doesn't matter what we do from the Ministry of Health's perspective. When you go home, it's up to you, right? And just to touch a bit on the BMI, we use BMI as a crude way because it's cheaper for us to go across Guyana to measure people like that. But for instance, people who are in gyms and so who are very athletic, the BMI would not tell you a true representation of if you're overweight because you'd have a lot of muscle and not fat, right? So for those of you at home, if you want to check right now, you're watching this program and you just want to check something to see if I'm a little overweight or obese, you can get a tape measure, measure your waist, measure your hip, divide that number. And if for women, if you're 0.85 and over, you need to be worried. And for men, if you're 0.9, you need to be worried. So you have a tape measure at home, you can go and do that. You have your phone, you can calculate it. And just check that. It's supposed to be a certain ratio, right? Everyone is different. And when we look in our mirrors, and over years, we know how our bodies change, right? So we can also observe how our body's changing and just don't be in denial. And if you're obese, if you're overweight and obese and needs help, you really need to come to the Ministry of Health. You can contact us at Food Policy Division for advice because we know it's really, really hard to get that, to make that change.
Yes.
So we're here for you to call us, come in, go to your health facility, make it important. It's not like a medication, you're going for a vaccine. Your weight and your health in terms of those things, they're very important. So make that special effort.
Thank you guys for joining me in the program today. It has been quite informative. I want to encourage you to keep up the good work that you guys have been doing at your various departments. Thanks once again.
Thank you.
Thank you.
For having us.
To you, our viewing and listening audience, thank you for staying tuned with us, the Health Matters program. This is Alicia Martin saying goodbye for now.